Welcome back. You already know the 7 steps. Now let us see them in action on a real-world problem. We will walk through 2 sector scenarios, climate change and gender and health. The steps will stay the same in both. Watch what changes. Let's start with Sector 1, climate change. Flood preparedness in Vietnam. The disaster management professional is helping the department and it has limited budget. The department needs to know which communities get priority support this year. Step 1, problem framing. She does not open a spreadsheet first. She makes the specific question. Not which areas flood the most, but which regions have the highest unaddressed risk given both hazard level and response capacity. Step 2, data. A database combines 4 different things for every region: hazard, vulnerability, exposure, and coping capacity. She checks for gaps and notes what is missing. Step 3, analysis. She calculates combined risk scores and maps regions which rank highest on hazard but lowest on capacity. The combination that signals the most urgent unaddressed need. Step 4, insight. She stops and asks, so what? She finds that the regions with the highest per capita risk are not the ones historically receiving the most funding. Her insight, in one sentence: the communities most at risk are consistently underfunded, and now we know exactly which ones. Step 5, decision. She recommends pre-positioning resources in these priority regions before the flood season. The recommendation is clear with confidence level stated. Step 6, evaluate. Before the brief goes out, she spends time stress testing the recommendation. She asks, what if rainfall estimates change in the data sparse regions? Does the priority list change if rainfall estimates for 2 data sparse regions are adjusted upward? She runs the numbers. The top ranked regions are identical under both scenarios. The recommendation holds. Step 7, communication. Her communication product: a 2-page brief for the national government, 1 map, 1 ranked list, 1 recommendation. 7 steps, 1 decision, done properly. Sector 2, gender and health. Specifically maternal health outcomes across Vietnam and the Asia-Pacific region. The decision maker here is a program officer at a public health NGO. Her question: which countries show the largest gap between what women need and what the health system actually provides? Step 1, problem framing. She does not ask where is maternal mortality highest. Her real question: where is the gap between need and access worst? Who is missing from the data? Because in healthcare, if a woman never reaches a clinic, she's simply not in the records. Step 2, data. She works with a dataset that combines maternal health indicators across countries, combining government hospital records with community health workers' accounts of the barriers women actually face. She notices immediately several countries have almost no community worker data. That absence itself is a finding. Step 3, analysis. She compares delivery rates of hospitals with pregnancy care completion. 2 indicators that should move together, but often do not. Step 4, insight. She finds countries with the highest delivery rates also have the highest dropout during pregnancy care. Women reach the first visit but do not return due to poor quality of care, weak follow-up, and provider behavior. The problem is not access. It is what happens after the first visit. Step 5, decision. She targets 4 countries for a pregnancy care continuity intervention. Step 6, evaluate. She tests the recommendation. Does the priority list change if the countries with missing community worker data are excluded entirely. The result? One country drops out of the top 4. She flags this uncertainty explicitly in the brief. Step 7. Communication. Her communication is not just a cabinet brief. It is a visual summary for community health workers in local languages. Same 7 steps, completely different data, different insight, and different communication format. Let me quickly show you what was the same across both sectors and what was different. A specific decision question before any data was touched. Honest documentation of what the data could not tell us. An insight stated as a sentence, not a chart. A sensitivity check before communicating, and a communication product designed for a specific audience. What was different? In climate change, the data was structured and quantitative. The communication went to a government official in a formal brief. In gender and health, the data combined structured records with qualitative community accounts. The communication went to frontline workers in local languages. Same workflow, different worlds. In the next video, we will see the workflow in 3 more sectors: journalism, public policy, and business. And we will look at the 3 most common places where even experienced analysts get the workflow wrong. See you in the next video.